name's Erin Smythe and I plan to do a systematic review of injuries, risk factors and prevention initiatives in pre-elite athletes. My interest in this is because last year I was lucky enough to be the physiotherapist for the Australian women's hockey team. We had a number of injuries last year that prevented athletes from taking part in training, which had a knock-on effect to performance and selection. It also took up a lot of my time, doctors' time and strength and conditioning coaches' time. A number of these injuries had occurred when they were adolescents in this pre-elite stage, and so I just think that more can be done to prevent these injuries from occurring in the first place. From the literature, we know that previous injury is a significant risk factor for future injury. We also know from the work of Ray Smith and Drew, 2015, who conducted a 5-year prospective study following 31 international track and field athletes, that they were 7 times more likely to achieve their performance goals if they took part in more than 80% of their planned training. We also know from the work of Gav et al. That injury in adolescence can predispose to injury at the senior level. They looked at 500 Aussie Rules players and showed that if a player had sustained a hip or groin injury as a junior player, they were 6 times more likely to have a hip or groin injury as a senior player. We also know that exercise-based injury prevention programs can reduce injuries in adolescents. So our systematic review is based on the fact that I'm interested in high performance sport, so we'll be looking at pre-elite athletes as per the FTEM model that has been developed at the Australian Institute of Sport. So this is the T3, T4, people that have been identified by talent. We will also be using the TRIP framework developed by Caroline Finch in 2006 to present this literature. This is a 6-stage framework that has not been applied to a systematic review before. And this will then identify gaps in knowledge to direct further research. So we plan to build on the work of Frisch et al. In 2009 systematic review, and we'll perform the same search with the 5 databases, and following on from their work from May 2009 to present. There will be 2 reviewers for data extraction and 2 reviewers to assess the risk of bias. And the literature will be presented using the TRIP framework. Following this literature review, we hope to undertake more research to help prevent injuries occurring in pre-elite